are in the cadaver lab, and we have some really cool pieces of equipment to show you today, as well as an example of an OR table. So I'd like you to pull up your lecture notes as you look over these things in real life. First, we have a right angle clamp, which has a right angle, and it has ratcheted finger loops here, which make it a clamp so that it's secure and locks down. We have an Alice clamp. An Alice clamp has little teeth on it. They're hard to see on the video, but you can see them in person. And it closes like this so that the edges don't completely touch. It also has the ratcheted finger loops so it can lock down, making it a clamp. We have Babcocks. Babcocks are also a form of a clamp because of the ratchets. And they have kind of an interesting shape to the end of them where it has like this little circle and it clamps down. We have a cryohemostat, which has a slight curve in it. It's not at 90 degrees, but a slight curve. Cryo, or you could say it makes you think of curved, right? And it also has the ratcheted loops so that you know that it is a clamp. And it also has little lines along the edge that make it clamp down more securely to tissue, and it holds tissue very strongly. We have a needle driver. There's lots of different kinds of needle drivers. So you have needle drivers in your suture kit. Just a reminder that they come in different shapes and sizes, and some have teeth and some don't. So take a look at those. Also with the ratchets. We have curved Mayo scissors. So they are slightly curved, just like in the pictures on your lecture, and they are scissors. Remember, the Mayos are meatier than the Metzenbaums. The Metzenbaums are thinner. We have an Army-Navy retractor. So one side is Army, one side is Navy. You can pick which side, I don't really know. And we have a couple more. Okay, this is a pool suction tip, which is also in your slide. And it attaches to this piece. If you just slide it in and then close it down, and then this attaches to your suction tubing. And then lastly, I brought over the DeBakey forceps. And remember, they have, actually it's quite impressive, the teeth they have here that will crush the tissue, so they're excellent graspers. Okay, we're gonna move on to the OR table. So over here is the OR table. It's usually a little bit larger than this, but this is roughly what you'd see on a typical back table. You have your equipment tray where all of these pieces of equipment were in, and now usually that equipment's on the table, or you have a second table, but we've taken it out of this box for you. This is a form of a drape. There are lots of drapes on this table. This is an extremity drape, and so if you were going to put it on the patient's arm, you would unravel it up their arm. Usually then we put Coban around it. You could also put it on their foot. This is a bulb syringe, and usually you put saline in here. You depress that, and then drain, depress it, and then suck up fluid, and then that can be used for irrigation. These are light handle sticks, so covers. So these would be sterile, so you can put them on the light cover sterilely. So if you look, it would be very similar to this. You just slide it on, and now your light handle is sterile. To take them off after the procedure is finished, they flip inside out so that you don't contaminate, and you can remove them. We have some suction tubing. We have a kidney basin or emesis basin. We have a disposable suction tip. More suction tubing. These are laps or sponges. They're really thick, heavy-duty things to dab away blood. These are 4x4s. These are not Raytex. These can only be used after the wound has been closed. These cannot be used while the wound is open. So these would be in a sterile pack to only be opened at the end of the case when you're applying the dressing. If during the case, you would use the ones that have the blue line in them, which are called Raytex, and they are made that way so that if they get stuck inside of a patient and forgotten about, you can x-ray the patient to find out where they're lodged. This is Bovie, and what this little holster should be attached to the patient drape. So after the patient is completely draped, the holster should be there. It's a safety thing because it holds the Bovie. You can also put other pieces of equipment in there. And the Bovie has 2 buttons. So the blue button is coag, that's to stop bleeding. And then the yellow button is cut, and that's to cut through tissues. This cord will be thrown off the edge of the table, so one end of it would end up non-sterile and would be plugged into the power device. I've got a couple of nifty syringes. We have a couple of little medicine cups to hold, like, for example, lidocaine or something like that. There's a couple of needles, a spinal needle, a regular needle. And there is this red thing. This normally comes as a case and it closes and opens. There is also normally a little foam pad in here. It's in one of the pictures on your lectures of the OR table, and it has a grid on it with numbers. And so when you have finished using a sharp, like a needle or a blade, these are blades, you would take that needle and poke it into box 1 or box 2 or box 3, and they can keep count, and they're safe because they're in like a little foam sponge, so they're not going to walk away or poke anybody. Usually they tape this little bag to the side as a little garbage bag for different pieces of things that get opened. And then we have a variety of drapes as well as a large basin. And the drapes would be on the table to be opened and draped on the patient once everyone has their glove and gown on. So remember, anytime you're approaching this table, you need to have your complete garb on, hat, mask, glove, gown. You should have already scrubbed, etc. So enjoy!